Dr. Lindsey, as always, and we're talking a little bit about summer safety and having kids in the water, something that a lot of parents are doing right now to get them out, give them some exercise. What safety tips do we need to follow?
Well, water safety is important for every age, especially children. There's 10 deaths every day from a water-related injury, and 2 of those deaths would be a child. So it's very important. The highest-risk children are less than 14 years of age, and usually between the months of May and August. Right now, it's high this weekend. We want to really watch that with children. So things we can do to help prevent it. Most of the accidents occur in our home. Over 75% of deaths from children occur in our home. So we want to really concentrate on preventing that.
Is that mostly people just not watching their children like they should be?
Number one thing we got to do is constant adult supervision. It's important to be an adult. If they know CPR, great. We don't want to leave our children with siblings or children or leave them for a minute, because kids can drown in 1 inch of water. So it's very important to be right there with them. And if they're in the pool, we want to have something called touch supervision. We want to be in there with them if they're small, at least an arm length apart from them. So if something happens, we can reach over and grab them.
Now, I was a lifeguard for 5 or 6 years. That doesn't mean anything now, but when I was a lifeguard, obviously you're doing a lot of people watching. That's your job. And I always wondered about, those floaties, the water wings, I guess is what you would call them. Would you recommend those for
an approved flotation device, not a water wing,
the one that goes on the bottom?
Yes, an approved one, and the child needs to have it on if they're in the boat or if they're in the water, or even if you're an adult and not really good at swimming, you need to have that on, or have a buddy system, someone in there with you. But the approved devices have to be used. Don't put them on a float. Don't put the little noodles on them or the wing device.
So you would recommend the kind that actually goes on the body and not on the arm?
Right.
I saw a lot of kids topple over. They get kind of top heavy, with those water wings, because they can't, balance quite as well.
Right.
Unfortunately, we have seen a lot of drownings recently in the lakes, people jumping off of bridges and stuff like that. If you're with a friend and they are in a panic situation, what should you do there?
Well, the main thing to do is not panic yourself. You always want to have, if you're in the water, have a phone with you or have somebody that you can get to that's going to contact, call 911. You get to them, get them out of the water. If they don't have a pulse and are unconscious, you want to go ahead and start the CPR immediately, because it's an emergency situation. But most of the adolescents and adults that have water injuries, alcohol related, so we really want to be conscious of that, because in sun and heat, you're more susceptible to alcohol. So the coordination's poor, your response time's poor. So if you're supervising or if you're having water activities, you really want to limit that alcohol use.
Now, for someone who doesn't know CPR, and we can't all take the time to go take a CPR class, I know that there's some just breathing type things that you can do for them. Can you go through that a little bit?
Yeah, you could just do chest compressions or just do mouth to mouth to them. Now most CPR, we get away from the mouth to mouth and just do chest compressions, and that will automatically help them have negative pressure and take that breath in.
So just plugging the nose and breathing through the mouth, just getting some oxygen.
And clearing the airway, putting your finger in, clearing the airway.
And we can talk a little bit more about sun protection as well. And what did you say was the best? Something
SPF of 35. Yeah, definitely.
Always 35 is, and what would you recommend for kids, like under the age of 5?
Under the age of 5, at least the 30, you want to do a PABA-free, chemical-free type of sunblock. It always wants to be broad spectrum, A and B, UVA and B rays. And you want to try to stay away from the ones that are aerosol. You don't want to put it in their face. If you're going to put aerosol on there, spray it away from their face and rub it in.
And speaking of sun damage, you have a clinic that can treat sun damage.
Yes, we have a laser wellness med spa, so we treat all types of photo damage. We do all types of aesthetic procedures, from facials to laser procedures to injectables. So,
and what is your regular practice?
Alabama Family Practice.
Alabama Family Practice. And how long have you been practicing?
Since 1995 in Montgomery.
All right. Yeah. Great to have you here, Dr. Lindsey. She's going to be on every week. If you have health questions, you can send them to us, and we'll have a new topic every week. It won't always be safety type stuff. And we'll talk diabetes, healthy eating, stuff like that. And she's always got great answers. So Dr. Lindsey, thank you so much for being with us. We always appreciate it.